Good afternoon, dear friends of IR. Welcome to the live studio from Vienna. Unfortunately not Munich, but I think we had a great first day here at the Summit 2020 from CIRSE. I think the experience was awesome. Besides some small glitches at the beginning of the day, everything went very smoothly. I have to admit, I'm a little bit tired from cruising around the entire platform, from sessions to posters to on-demand to the industry booth. So I think it was an exciting first day, and I'm very happy to have with me joining Stefan Müller-Hülsbeck, the coordinator of the PAD Day, and Adam Hatzidakis, the Deputy SBC Chair responsible for the program. I will start with Stefan. Stefan, please tell me, what is your personal highlight of the day?
There's not only one personal highlight. The personal highlight is, I think, that Fabrizio Fanelli has conducted an outstanding program. So it's the second PAD Day this year we conducted, and he has made a major contribution. And as a scientist, I have to say the highlight for sure is always the first at CIRSE session with 6 different presentations. But to be honest, I think each of the sessions was a highlight. It was outstanding. We had the virtual daughter auditorium the whole day. That was great. I don't know about the attendance, but I had a feedback so far from the questions from the virtual audience, from the discussion we had during the sessions, and my personal first impression was, I think it was a rather good success.
Yeah, it seems like there were more questions that you were able to answer as a moderator. I think that is a good sign. Let's talk a little bit about the first at CIRSE. I mean, you said 6 great topics. Which one we want to highlight again? Which one is maybe the one you think is most important? Maybe you cannot take the one you are involved, but take something else.
My presentation was definitely not the most important one, but probably I'm a little bit biased with this kind of answer I have to give you now, because I think dealing with drug-eluting technologies, and I'm involved a little bit in that, I think this was for me the highlight. And whether it was the presentation from Mike Dake or from other ones, it has shown the first at CIRSE that drug-eluting technologies, especially dealing with Paclitaxel, either on a stand as a drug-eluting stand or on a balloon as a drug-coated balloon, I think really plays a major role during this scientific event like first at CIRSE.
I think also that when we listen to that we gain more information about the whole discussion about Paclitaxel. So your personal use of it, it seems like you're still using it. Give you maybe the idea when you use it or when not to use it maybe.
I would say we don't use it in every patient, but we almost use it in a lot of patients. And it belongs to our bread and butter business, mainly drug-coated balloon technology, but this has a certain reason because in Germany we get reimbursement for that. For drug-eluting stand technology, we don't get any reimbursement. But what I want to highlight, it's of utmost importance nowadays, since we have to deal with the meta-analysis from Katsanos, that the informed process is now a little bit prolonged, a little bit more detailed, that we have to report about the findings of late signal like mortality. But if we balance that against the benefits of drug-eluting or drug-coated technology, I think there's a certain or a clear advantage for drug-based technologies, and therefore we recommend, we offer the patient when we think there is a need for drug-coated balloons or even drug-eluting stents, then we still use them. And I would recommend that this kind of technology is safe. There are no hazards, no hard risk, but we have to inform the patients by law. That is now necessary nowadays.
Switch a little bit gear, Stefan. The foot recognition. I think it seems to me that we are getting more and more distal. I wait for the first toe PTA, but let us know a little bit about the techniques for the foot. I think this is greatly advancing, but what is your take on it?
So the patients are getting older and older, and we have to deal with multi-level disease. And if we go down to the foot, then sometimes we really have to deal with this so-called desert foot. And I have seen today, and I think this is now really proven, that there is nothing to lose, and we have to try everything in these dedicated and these challenging patient group, and especially the techniques getting access from the artery to a vein in order to perform some kind of arterialization of the veins seems to me outstanding for this severely diseased patient group. And I'm very thankful that we had today outstanding presentations presenting these techniques and the challenges we have to deal with, touching probably some unmet needs we still have. But I think we are on the right track with IR, and IR serves excellent in this dedicated, challenging CLI group in order to improve their disease, their long-term disease.
Very good. Adam, to you. Also, let's start also with your personal highlight of the day.
My personal highlight, first of all, I was amazed by the organization, the technicians, the studios, the support, and all the technical organization. It had to be invented to transform the life to an online congress. We started last October with the program committee, and everybody told me when I was elected that this is the most difficult thing to do. The couple of days in Vienna for the program of next year. It turned out that the most difficult part of the job was to reorganize the whole program and do it again, but this time on a terra incognita landscape, because there were so many problems to be solved, and really the CIRSE office and Thomas Krenke did a great job. And I'm really amazed about how it worked today. So this is the first comment I have to do for the first day. Then my personal participation was in two sessions today. One was an expert roundtable, and the other one was the video live sessions. These were totally different sessions, because in the first one there were, let's say, on the edge of knowledge, and everybody presented what should be done in our discipline according to the recent literature. And according to this, the questions were also on this level. So the audience, I would say, and the questions from the audience were on the edge of knowledge. The philosophy for the video session planning we did last year was that it should be more basic stuff, show everybody the state-of-the-art procedures as they should be performed. And sometimes we try to have similar procedures with different approach and techniques, so that we can correlate and explain the youngers that it can be in this way, but it can be also in the other way. And I think today's session was such an example. And the videos were outstanding. The presentation was fantastic, and the discussion was really very good. And we saw that this came to the audience exactly on this point, because the questions were totally different. They were from younger radiologists which wanted to learn more about the basic techniques. And I hope we help them all. And last but not least, I would like to highlight the role of the moderators, because on the live sessions, the presenters are the stars. Here, we tried to shrink a little the presentations and have more time for discussion, which is very good for the audience. And I think the role of the moderators was very important. And I think they did a great job, and I hope it continues also for the next days.
Very good. Just a quick question on the first session you talked about. I thought it was a very interesting case. Something IR is doing for many, many years. now we are still doing some tweaking on it. Can you maybe tell the audience a little bit what you think you took out of this session which you may change your practice?
In TACE, I think there is nothing definitive. I mean, many are still performing the conventional technique. Others are doing the beads. Others blunt embolization. Others combinations. And there is nobody who can say, I do it this way and this is the correct way. It depends on the case, depends on the tumor, depends on the vascularization, depends on the size and the location of the tumor. There are now open questions about immune therapies which could be combined with these tumors. And there is also a question about treating larger tumors without complete response, because leaving behind a living tumor, this can induce the immune response from the organism. So there are many open questions still, and there is no definitive answer. So we will work on this.
It's good there's no definitive answer. We need something to tell about and talk about next year. Right. Quick question towards the end, Stefan. We had also a session about thrombectomy. I think in Germany, IRs already take a quite active role in that treatment. Can you maybe tell us a little bit about this and what your personal take on this is?
I think everybody knows Germany is well good organized in terms of stroke treatment. I myself, we belong to one of the biggest stroke centers in Germany. It's a huge effort to organize it, and my key message would be to have a combination of or a close cooperation between neuroradiologists and radiologists in order to organize that. Not every hospital has a neuroradiologist available, and in these kind of hospitals, the radiologist has to do or has to manage the workload. And I think this is fine. This works until they get well trained.
Adam, what is the situation in Greece?
In Greece, we're just starting with this. We are trying to organize the stroke centers in key cities and key hospitals. And we are learning from Germany and Central Europe. I'm happy that we have to cooperate with neurointerventionalists, because as far as I know, in Germany in the past, they didn't talk to each other. Different departments and different doctors, different directors, and now they have to cooperate together. And this is very good news.
All right, I see the door opened. I think we'll be joined by more members of the studio in Vienna. Please welcome them. It's Philipp Pereira, Afshin Ganji, and Thomas Krönke, and they're not coming alone. They're bringing something to drink with us. For you all, I wish you all the best. From Vienna, not from Munich, unfortunately, but I say with the whole team, cheers. And this is the final wrap-up of the first day of the summit. I hope to see you all tomorrow. Cheers!
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 Cheers! Without much.
Cheers. 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 Cheers.